And we're back, dear viewers, with our first guest. So today we welcome Dr. Abdullah Alfawaz, an assistant professor of surgery at Kuwait University and vascular and endovascular surgeon, to talk about one of the most serious health issues, cerebrovascular diseases, which are among the main causes of stroke, a condition that can change a person's life in a single moment. Dear viewers, we will learn what these diseases are, how they start, the early warning signs that should not be ignored, and the latest methods of diagnosis and treatments. So, dear viewers, let's all welcome Dr. Abdullah. We are very happy to have you on Good Morning Kuwait.
Thank you for having me.
It's a pleasure to have you here, doctor. So we would love to know about this disease and what's it all about.
Of course. So talking about cerebrovascular disease, if you break down the word, cerebral medicine usually refers to the brain.
Right.
And vascular is blood vessels. So there are blood vessels that lead to the brain. And this is not exclusively the blood vessels inside the head or inside the skull. It includes the vessels from the almost upper chest all the way inside the brain. So these are the vessels that take the blood from the heart to the brain. And anything that affects them can affect the brain, which is the end organ that's supplied by them.
All right, so anything flowing from the heart to the brain is is cerebrovascular.
Exactly.
All right, that's cool. And doctor, how does this disease lead to strokes?
It can lead to strokes in different ways. So it can lead to stroke by occluding the vessel, which is blockages and clots inside the vessels, and these lead to decreased blood flow to the brain. And it can lead to strokes by bleeding inside the brain that can cause a stroke in the same manner, and it's usually related to lack of oxygen to the cells in the brain.
All right, so doctor, we would love to know the difference between a stroke caused by blockage and a stroke caused by bleeding.
The majority of strokes are caused by blockages, so 85% are caused by blockages. And thankfully, that's the case because these are somewhat milder in terms of symptoms, and they have better outcomes than the bleeding strokes. They're also treated very differently than the strokes caused by bleeding. So these are the main differences, but on the outside, we can't tell which is which when the patient comes to us, and we can only tell by imaging tests.
All right, so doctor, also since this disease is really important to know about, does it affect any other part of the body, or is just the brain and the heart?
Blockages to the arteries and disease of the arteries can affect arteries all over the body. So you hear about them in the heart and legs, but cerebrovascular disease, as the name implies,
yes,
affects only the vessels we talked about, for the vessels that take blood from the heart to the brain.
And does it, obviously it affects something else, like there are signs to it? Or
Signs, so signs of having a stroke, for example.
yes.
Signs of having a stroke, unfortunately there are no early signs of having a stroke. Some people are, I wouldn't say lucky enough, but they're luckier than people who have a stroke. They have something called a mini stroke, or a TIA, a transient ischemic attack. And what this is as the layman terms imply, a minor stroke or a temporary stroke. It's patients who have stroke symptoms that are very limited. It takes maybe 5-10 minutes in most patients, and then everything goes away. So usually they come into the emergency room and they explain what they had, but usually goes away on the way to the hospital. And they get all these tests and they're normal. So the best case scenario is to identify what caused this to avoid a major stroke later on.
All right, doctor. And Dr. Abdullah Alfawaz, it's such a pleasure to have you here to know all about this information. And does this disease affect young people too?
It can, but very rarely. The majority of the people we see are above 50 years old, and usually in the 60s to 70s. Those are more than 90%. It's due to accumulation of cholesterol, plaque in the arteries that takes many, many years to develop. A minority of these patients might have some hereditary diseases, might have some abnormalities of the arteries that predispose them to the same conditions, but these are only a minority of patients.
Okay, so doctor, I'm gonna ask you this question. How does peripheral and or heart vessels disease differ from cerebrovascular?
They don't. So if we take a sample of these arteries in the heart or in the legs with arterial disease, and we look at them under a microscope, they're almost identical. The only difference is the effect of blocking this vessel on the patient. So if it happens in the heart, they have a heart attack. If it happens in the legs, they might have problems with gangrene or other problems that lead to limb loss. And in cerebrovascular disease, it can lead to stroke. So it's only dependent on location. The causes are the same, the way it looks are the same, but it's just the location that determines the outcome.
All right. So God forbid, you said all the risk factors that kind of lead to this disease. And doctor, you mentioned something about heredity. What is heredity and how does it play a role?
So the risk factors, we haven't mentioned all of them. The most important risk factors to develop these problems, similar to the heart again, and similar to the legs, are smoking, diabetes, high blood pressure, and high cholesterol. These are risk factors that we can control. So we always advise our patients to either control the conditions they have, to quit smoking, change lifestyle, to decrease the risk factors to developing these conditions. Other factors, like hereditary factors, are factors we cannot control. So we call them non-modifiable risk factors. So genetics is one thing, age is another thing. So as we grow older, we're more prone to having these problems. And gender is the last thing. So males are unfortunately more predisposed to this due to hormonal influences.
All right, that's not good news, doctor.
No, not at all.
All right, so doctor, also you've mentioned a little bit about early signs of a stroke. How can people assess themselves to know how to manage a stroke if it's coming?
So there are many initiatives to raise awareness about stroke symptoms. And this is very important, just like what we're doing today, to let people know how to identify a stroke very early, because every minute counts. So stroke symptoms, the most common symptoms are sudden weakness or change in sensation, so in half of the body. So somebody would have, suddenly they cannot move their leg, they cannot move their arm, one side of the body, the other side is fine. This is a major stroke symptom. Changes in speech or swallowing is another symptom. And then the last thing, which is not very specific, but if somebody has a sudden bout of confusion, they cannot talk, that's another thing. And if any of these happen, the patient should go immediately to the emergency department of the closest hospital.
Okay, and Dr. Abdullah, after getting diagnosed for a stroke, what urgent steps must be undertaken at the hospital?
Every emergency response team will know what to do for a stroke. So the patient has to get to the hospital. The symptoms we mentioned suggest a diagnosis. The first thing they do usually is they get a CT scan of the head. And the reason why that's done is to exclude a bleed inside the head. So we talked about how 15% are due to bleeding, the strokes.
Yes.
So once that is excluded, then we can start the treatment algorithm for stroke that's due to blockages in the brain. And that entails using a clot buster medication, a medication that melts the clots. This medication can only be used in a small window. So the first 3 to 4.5 hours, we can use this medication. And this is why we want the patient to get to the hospital early, so we can have time to get the CT scan, assess the patient, and give the medication before this time window ends. And this medication, what it does, it melts the clots inside the brain that cause a stroke, so the patient can go back to being normal again.
Yes, thank God for having you here, doctor, so you can save all the people here in Kuwait. Doctor, the routine tests that should be done after stroke diagnosis and their initial treatment, would you explain more, please?
There are some routine tests that are done to look for the cause of the stroke that happened in the first place. So what we do as physicians is we don't usually treat the stroke that happened. The stroke that happened has happened already. Unfortunately, the nerve cells in the brain are very sensitive to lack of oxygen, and these cells die. The other cells in the brain take over their job, usually over time. And what we want to do is to avoid a stroke at a later date. So what we do is we look for a cause. Why did the stroke happen in the first place? There are some routine tests we do, and these tests look for causes that we can reverse. The most common causes that we can reverse are diseases in the blood vessels, something that I treat. So in the carotid arteries, for example, in the neck, we get an ultrasound of the neck, and we can get an echo, which is an ultrasound of the heart as well. So problems with the heart, valves of the heart, they can develop some clots, and these clots can fly and go through the blood vessels into the brain.
All right, doctor, that's really good insight so our dear viewers can know how to avoid these kinds of things. And are there any preventive tests for people at higher risk?
In terms of prevention, we can talk about screening. So screening is done for people who have never had a stroke in the past, but are high risk of having a stroke. These people include patients who are older in age, have the risk factors for blockages in their arteries anywhere in the body, and specifically patients who already have blockages somewhere else. So somebody who comes to us with severe blockages in their legs or in their heart, for example, they're very likely to have something in the arteries of the neck, the carotid arteries or the vertebral arteries that can cause a stroke. So these people should have some sort of imaging. We usually get an ultrasound because it's simple, there's no harm in doing it, and we can check their blood vessels and catch this problem early.
All right, dear viewers, you heard it from Dr. Abdullah Alfawaz. You must really take care of yourself and to avoid these kinds of diseases. Also, doctor, the role of a vascular surgeon in the stroke treatment, how does it come?
So what I do as a vascular surgeon is we try to clean up the arteries or treat the arteries that cause the stroke in the first place. We talked about the cerebrovascular arteries in the neck, and this is the territory of a vascular surgeon. We can treat these in a number of ways, usually surgically, but we can also place stents there. But the purpose is the same. The purpose is to prevent that piece of plaque in the artery to break off and cause a stroke at a later date.
Yes, hopefully, and to keep everybody safe, inshallah. Doctor, treatments that are available here in Kuwait, and now since we're in 2025, is it developing or are they the same treatments as before?
For stroke, treatments haven't changed that much over the past, I'd say, 50 years. There are some additional treatments that are available for some patients, but the mainstay of treatment for stroke is, or for stroke caused by carotid disease, is what we call an endarterectomy, which is cleaning up of the artery from the inside. We do a surgical procedure in the neck. We open the artery, we remove the plaque that's causing the problems, and then we close the artery back up again. And this restores normal circulation. The new addition, or the new technology that has been added, is placing stents, doing this minimally invasively. This technology is good for some people who cannot tolerate surgery or have some reasons why we cannot do the surgical procedure in the first place. But for this specific problem, stents are not as good as surgery. So it's a second line intervention.
That's very great to know, doctor, and thank God you are here to save us, doctor. So, doctor, do you have any final message for our dear viewers today?
The final message is we talked about the risk factors, so make sure you stay away from smoking, live a healthy lifestyle, and if there's any symptoms of stroke or stroke happens, then you should try to see a vascular surgeon to evaluate your arteries to prevent a stroke from happening again.
Yes, definitely. Thank you so much, doctor, for being here on Good Morning Kuwait and explaining everything to our dear viewers.
Thank you for the chance to raise awareness.
It's our pleasure. So, dear viewers, many thanks to Dr. Abdullah Alfawaz for his clear explanation about this disease and their links to strokes. What we learned today, dear viewers, shows that noticing early signs and following healthy habits can help prevent stroke and protect our lives. So, dear viewers, we'd all love to thank our doctor again, and we shall take a short break.